Hi guys, you guys did a wonderful job on your presentation. I thought you did a great job at speaking about the etiology and the clinical manifestations of autism. I think it's great that you guys included that having a vaccination is not a cause of autism. I think a lot of parents these days believe that, especially obviously with our Marcella mumps and measles vaccine. So it's very important for us to be educating parents overall in general, even with kids that don't have autism, that this is not a cause. So that also will help with the vaccine promotion. Speaking about, communicative impairment is like one of those huge signs for autism. I thought you guys did a good job at explaining this. Is usually one of the common like presenting signs in young children who are going to be diagnosed with this. And I think it's important that to help with these delayed, language delays is always through like prevention. So when a child will start, when you start noticing your child having like a language or speech impairment, it's important for you to like start going in and figure out from an audiologic evaluation within like the first 3 to 6 months, if possible, of age. And speech therapy should be initiated immediately because this is going to help with making sure it doesn't progress or get worse. Prevention also involves like early recognition, obviously, like I said, for children who are going to be at risk for these language delays. And timely intervention is going to be very important to help promote the adequate language development for these children. Nurses are often going to be able to provide education for these families, and that helps them foster the child's communication skills as well. Um, So having, hesitancy and speech patterns, going to be probably normal when they're younger, like I said, and you guys kind of explained that well too. Um, it's really going to kind of start because, these children know what they want to say, but they're going to be hesitant, or maybe they might repeat words, or like the sounds that they're trying to say aren't going to come out right. So they're not going to be able to express themselves. It's probably going to be very, frustrating for them. So we have to be patient. Um, So, as parents or like any other people in their lives, if they start putting like stress on the child when they start having, these difficulties or any sort of abnormal speech, it can be like really stressful for the child. So, so it's just kind of important to be patient with them, I believe, and then as well as like really having that prevention and having that early intervention starting and getting as early as possible and kind of just like advising these parents that it's important to be patient with them, and if they do have um if they do believe they have huge concerns about their child, not like if they become frustrated or if they really see them struggling, it's going to be really important for them to continue those speech and language evaluations throughout. I was just wondering if you guys have any experience with any autism patients, maybe, or even autism children in your lives. I know my cousin, he is autistic, and he's 24 years old, and he still struggles, and he is a bit antisocial, so we try to whenever at family gatherings, we really try to kind of like include him, but we don't want to like ever really overwhelm him. So we always kind of let him approach us without making him too anxious because he gets really anxious sometimes when people are really trying to be dominant in conversation with him. And I have had I just had a patient when I was working a couple weeks ago who was an older, a younger adult male. I think he was about 22 years old, and he also had autism, and he was completely nonverbal with me. But he was very polite, and I always made sure that when I was going in the room, I was explaining everything that I was doing to not frighten him. Um, so I was just wondering if you guys had any other experiences that you might be able to share with us. Thank you.